So this week we will start talking about the axial skeleton. We're going to focus on the skull and facial bones. The bones of our skeleton are divided up into two different types of skeleton. We have the axial and the appendicular skeleton. The axial skeleton contains the head, neck, back, and chest. So it's like the main middle part of your skeleton, the structural support part. And then this contains skull bones, face bones, the spine or vertebrae bones, and the thoracic cage, which is your ribs and your chest bones. The appendicular skeleton is everything else. So this is the arms and the legs and all of their attachment bones. The skull. The skull's main function is protection, and specifically protection of the brain. The brain is one of our most vital organs, and just a little amount of damage to the brain can cause life-altering changes in a person and their quality of life. So we need to make sure that this is protected. Our bodies are designed with this very, very hard protective skull to cover the brain, and it also covers our eyes, ears, and nose. It covers our special senses. The skull also protects the blood vessels that feed the brain, because they are under the bones, and it protects the nerves that attach the brain to other parts of our body so we can receive signals from those parts of our body. The skull also serves as a point of attachment for facial and scalp muscles. So we have muscles on our face and on our head that allow us to make faces, lift our eyebrows, move our mouths, all that stuff, but they have to attach somewhere. They don't just lay on there. They would slide off. So they're all attached to things, and the skull serves as a point of attachment for many different muscles. The skull is broken into two different regions. We have cranial, which is the head, and facial, which is the face. So when we talk about the bones of the skull, we're going to break them up into those two categories to make it a little bit easier. Major structural terms. There are a few major structural terms. These terms generally have the same meaning in different parts of our body. First, we have a foramen or a foramina, if it's plural. This is an opening hole or a passageway in a bone that allows for nerves or arteries to pass through. Our skull has quite a few for facial nerves and a really big one for the spinal cord to enter into the skull so it can attach to the brain. Then there's depressions. These are pits or cavities or a little dip in a bone. They usually articulate or move with another bone. There's a process, which is like a little projection, outgrowth, or like a little bump or a notch on top of a bone. It's usually sticking up or out. And then there's body. So the body of a bone is typically the largest part or the main part of the bone. Okay, cranial bones. These are the bones of the head. The skull consists of 8 cranial bones. The main outer skull consists of 6 large bones. These bones are the frontal bone, a pair of parietal bones, a pair of temporal bones, and an occipital bone. There are also 2 smaller bones that are inside the eye sockets and inside the nasal passage. This is the sphenoid bone and the ethmoid bone. So the sphenoid bone is in the orbital floor, so it's inside the eye socket towards the bottom, and it makes up the bottom inside base of the skull. When you're looking at the skull from the front, it's kind of butterfly shaped. The ethmoid bone are these very, very tiny bones that are in the roof of our nose. So together, all of these bones make up the skull part of our, the head part of the skull. So the frontal bone is pretty self-explanatory. It is the bone that's in the front. This is our forehead. It has notches on it that make our eyebrow notches. It protects the frontal lobe of the brain. The occipital bone is in the back of the skull. It makes the base, and it protects mainly the brainstem is back there, and then there is a lot of muscles that attach to that area of the skull. So the frontal is in the front, and the occipital is complete opposite, and it's in the back. Here we have the parietal and temporal bones. The parietal bones are the largest part of our skull. It's the side. There's a right and a left. These protect the right and left parietal lobe of the brain. The temporal bones are at the temple area of our head, right in front of our ear, kind of on top of it. There is a right and a left. They protect the temporal lobe of the brain and the cranial nerves, so the nerves of the brain that are behind there. On the temporal lobe, there is a mastoid process, which is a little notch that sticks out towards the bottom. And this is where the neck muscles attach, so you can move your neck back and forth and up and down. Then there's the external auditory meatus, which is an opening in the skull that works to allow our ears to hear. And then there's the styloid process, which is a little stick-like thing that sticks out near the mastoid process. And this articulates with the hyoid bone in our neck. The sphenoid sits behind the frontal bone, but in front of the occipital bone. So it's kind of in the middle of the skull, and it forms the floor of the skull. If you're looking at it from the side, it appears to be in front of the temporal bone, but from the front, if you look through the eyes, if we could see through the skull, it would look like a butterfly, like right in the back of the eye canal, like the orbital canals. So this is the majority of the skull's floor. It has some really important parts. So first we have the greater wing, which if you look at this bottom picture, it's the red part. It would be like the big wings of the butterfly. Then we have the lesser wing, which is this little green thing that kind of looks like Yoda's ears. And then we have the body. The body is going to be the main part. So in this case, it's the middle part. It's this blue. We have a foramen ovale, which is an oval foramen. So it's a hole that allows for a nerve or an artery to pass through, and it's oval shaped. And if you look at the bottom of these greater wings, there is an oval hole there, and that's so the mandibular or the nerve of the jawbone can pass through and get to the brain. There is a portion of the body. If you look at this top picture, you can see there's this little notch. It says optic groove. Below that is this notch. Underneath that is this little hollowed out depression. Remember, depression means it's an area that's hollowed out or a hole. There's a depression there called the stella turcica. This is where the pituitary gland sits. It kind of protects it and houses it in there nice and tightly so it doesn't get damaged easily. The pituitary gland is very, very important for hormone regulations. So that is housed inside the sphenoid bones, stella turcica, which is in the body. And the only way to see the opening or the depression where that sits is the superior view of the sphenoid bone. So this top image is a top down. You're looking from the top down onto the sphenoid bone. And the colored image is looking in an anterior view, so looking forward straight on into the eyes of the skull. The ethmoid bone is a smaller bone that's located behind the nose. It forms the roof of the nasal passage and part of the wall of the eye socket. The major parts of the ethmoid bone that are important to know are the crista galli, which is the midpoint. It's kind of like a ridge that runs down the middle. And this serves as an attachment for membranes that go around the brain. So the brain is surrounded by these membranes that protect it and keep the fluid around it. Those membranes attach to that little part of the bone. Then there is a cribriform plate, which is at the base of the skull, and it allows for the olfactory or the smelling nerves to enter the brain. So the cribriform plate is a flatter part of the ethmoid bone, and its function is to attach the nerves that allow us to smell. In relation to the cranial bones of the skeleton, we have things called sutures and fontanelles. So sutures are these fibrous tissues that connect skull bones. And if you think about what sutures do, sutures are stitches, right? They connect things together. So our skull bones are connected. They're not fused together, but they're connected by fibrous tissues. This fibrous tissue is very elastic and flexible in infants. It allows for the bones to move and shift as the baby's brain is growing. And it allows for flexibility, so if a baby falls and hits their head, the bones are not stiff. It's very flexible. It can save them from doing a lot of damage. And then also when babies are born, when they come to the birth canal, their heads are too big. so they kind of get squished during birth. That flexibility also helps for them to pass through the birth canal easier. And then there are fontanelles. So fontanelles are also what we refer to on babies as soft spots. If you've ever felt the top of a baby's head, there is a gap where there is no bone. You can literally touch the skin and you can feel that it's soft underneath. You can usually feel a heartbeat underneath it. There's no bone there. And if you look at this picture, it's like a little diamond shaped area in the front and a smaller diamond with a triangle in the back. Those are openings between the skull bones in infants. So you have a posterior and an anterior one, so one towards the front, one towards the back. The posterior usually closes by 1 to 2 months of age, and the anterior between 7 and 19 months of age. This allows for brain growth and flexibility in the skull that is needed for brain development. Moving on to the facial skeleton. The facial skeleton is made up of 14 bones. 6 pairs make 12 of the bones, and then there are 2 more individual bones. So the facial bones have a few functions, such as protecting the brain and special sense organs like our eyes, our nose, our tongue, inside of our ears. And they also provide a framework for muscle attachment. These muscles allow us to eat, speak, breathe, make facial expressions. If we didn't have these features on our face and these notches and grooves, the muscles wouldn't have anywhere to attach. First, we're going to go over our jaw. There are 2 bones that make up our jaw area, the mandible and the maxilla. The mandible is our bottom jaw. It's the strongest bone in the skull, the largest bone in the skull, and the only movable bone in the skull. When we chew and talk, we only move the bottom of our jaw, not the top. That is the mandible. Our lower teeth are in that bone. The upper part of the mouth and jaw is made up of the maxilla. The maxilla makes like your upper lip area and around the sides of your nose up to your orbital sockets. It holds the top teeth in, and it forms the upper palate of our mouth. This is really important for speech and chewing. Now we have the mandible. So the mandible is the largest, the strongest, and the only movable bone in our skull. The mandible is your lower jaw. It allows for chewing and speech. So some important features of the mandible are the head and neck. So the head on this top diagram here is the green rounded part. This articulates with the skull. It articulates with the temporal bone at the zygomatic arch of the cheekbone to make the temporomandibular joint. This allows for the mandible to move up and down while we're chewing, and also can move a little bit side to side. If you move your mouth, you can tell that it goes slightly side to side. The part of the skull that the head of this bone sits into is called the mandibular fossa. A fossa is like a little smooth area for one bone to sit in and articulate or move with another bone. So the mandibular fossa is the articulation point for the mandible. Looking at this top diagram again, the pink part is the body. The main job of the body is to allow for the teeth of the lower jaw or the mandibular teeth to attach. The primary purpose of those is for chewing. And remember when we talked about major structural terms? The body of a bone is the largest or the most functioning part of the bone. Also within the mandible is the mandibular foramen. The foramen is either a canal or a hole or a passageway for a nerve or an artery. And this one allows for a nerve to pass through and go into the skull so it can get to the brain. All nerves try to go to the brain, or a nerve branch off the brain, because their goal is to get signals back to the brain. We have the coronoid process, which is near the head. It's also this little top notch part here. The main function of this is to keep the mandible in its track and prevent it from dislocating when we're moving it. And then there's a couple parts that have muscle attachment functions. So the ramus, which is this lime green area, and the angle, which is the bend or the angle of the mandible, those are both primary locations for muscle attachment. The muscles that attach our mandible to our skull are very large. They are called masseter muscles, and their primary function is chewing and speech. So they have a lot of points of attachment because they're very important muscles, and we use them all the time. And then lastly, we have the mental foramen, which is, if you look on this left picture of the mandible, it's these two little red dots. There's one on each side. This is another hole that allows for a nerve to enter in and get to the brain. Okay, so we talked about the lower jaw. Now let's talk about your upper jaw. So your upper jaw is called the maxilla. Technically there are two, although they are fused together. This is your upper jawbone. It holds the maxillary teeth, which are your upper teeth, and it forms the top palate of your mouth. This is needed for speech and mastication. If we didn't have the palate in the top of our mouth, we wouldn't be able to push things with our tongue for chewing, and we also wouldn't be able to use our tongue to make sound or speech. Some important parts of the maxilla are the palatine process of the maxilla. So in this picture on the right here with the red roof of the mouth, that is the maxilla, but it's the palatine process of it, meaning it's the part of the maxilla that forms the palate of your mouth. And then remember, the palatine bones are attached here too, which we'll talk about in a second. And then in the maxilla, you have the infraorbital foramen. Foramen, again, is a hole in the skull or a bone that lets an artery or a nerve enter. This one allows passage of orbital nerves and blood vessels. And if you look at the skeleton with the two little red dots on his cheeks, that is where the infraorbital foramens are. You have one on each maxilla, a right and a left. Nasal bones. So our nose is made up of two sets of bones and one individual bone. First we have our nasal bones. These are the bones that form the bridge of our nose. They protect our nasal cavity. Then we have the inferior nasal conchae. This forms the lateral wall of our nasal cavity. So the outside wall. These aid in filtration and humidification of the air. And then we have the vomer. The vomer divides your nasal cavity. So it's the bone in the middle that makes your nasal cavity have two canals instead of one. The zygomatic. This is probably the weirdest named bone in our skull, so it should be an easy one to remember. The zygomatic is your cheekbone. You have a right and a left zygomatic. They form the lower outer portion of your orbital socket, and they also provide an extra attachment point for chewing muscles on the side. On your zygomatic, you have a zygomatic arch. This is what connects the side of your skull to your jaw or your mandible. The mandible meets the zygomatic arch at the temporal bone. If you look in this bottom picture, it's the green. This protects the eye and also gives another point for muscle attachment. The chewing muscles are very large and have a very big job, so they attach in many different places. The palatine bones and other special features. We have two paired bones that make up the palatine bone. They are located behind the maxilla, the back roof of your mouth. They form the palate of the mouth, and they also form a small part of the floor of your nasal cavity. So it separates the top of the mouth from the bottom of the nose. On this picture, it is the yellow. And then we have the foramen magnum. Now remember, a foramen is a large opening or a hole in a bone to allow for either vessels or nerves to pass through. In this situation, we have the foramen magnum, which is this big hole right in the center of your skull. This allows for your spinal cord to go into the skull and attach to your brain. And we have a jugular foramen. These are these little oval-shaped foramens. There is one on each side, the left and the right, and these allow for the jugular to go in to the skull and enter the brain so it can pump blood to it. Lacrimal bones and orbital accessories. So we have two lacrimal bones. Lacrimal refers to tear duct. Okay, so the tear duct is called the lacrimal duct. The lacrimal bone is the bone that sits right below the tear duct. It provides support and an attachment place for tear ducts and the orbital muscle, so your eye's big muscle. The orbit is the socket where your eyeballs sit. So you have two. You have a right and a left orbit. There are bones that create the orbit, and these are the bones that protect the eye. These bones are the frontal bone, so the forehead, the zygomatic, the cheekbone, the maxilla, your upper jaw, the ethmoid, which is inside, the lacrimal, which is the tear duct area, and the palatine bone, which is the roof of your mouth, the very back, the palate. Within the orbit, we have a few little important features. There is a supraorbital notch, and if you look on the skeleton, it's kind of in the middle area towards the nose of the eyebrow. It's just this little notch. This is a channel that allows for a nerve to kind of lay in there and go smoothly, so there's not like a nerve poking out of your skin, kind of. And then there's the optic canal. This is the canal in the eye. It's a little hole that allows for the optic nerve to go from the eyeball through the skull and into the brain. Lastly, we have the hyoid bone. This one's easy. It's just one single bone. It's in your neck. There's no other bones around it. It is small. It is U-shaped. And it's the only bone in our entire body that does not articulate or move with another bone. So it doesn't touch any other bones in our body. This allows for tongue attachment to the throat so it doesn't fall down. And it is attached to the styloid process, that little stick part that sticks out from the bottom of your temporal lobe or your temporal bone. It attaches to that by ligaments, not bones. When you swallow, if you put your fingers on your throat, you can feel something move up and down. That is your hyoid bone.